If you look for this phrase at the internet or media, the less hygienic celebrities, you can find all of these embarrassing moments of people from movie, rock stars, celebrities, and people from royalties. Nothing is further from reality. People who suffer of that, for hyperhidrosis and hyperhidrosis, have in general people associate sweat with poor hygiene and lack of personal care. But in addition to these people, all of us with high social or labor exposure, like us, like doctors, can be successful treatment for that. In general, in summarize, excessive sweating without any stimulus or rational cause. This is hyperhidrosis. Okay, osmidrosis caused by apocrine glands that create ceramides. These ceramides, when reach to the skin, be in contact with normal our bacteria in the skin and produce ammonium and fatty acid, and that generates a strong smell. And this smell is different from each of us. And the population of this bacteria is different, usually Staphylococcus, but some patients have Corynebacterium and anaerobic bacteria too. And this is the worst smell that we can produce. Well, our patient create a special pattern of behavior to avoid people notice that they have odor on the armpits or they are sweating, like use loose clothing, like avoiding hugging, and this is all to avoid people notice of this problem, of the disease. There's a scale, the hyperhidrosis disease severity scale is only subjective. The patient need to ask the way that this disease alter or interfere with continually habitual activity. And the osmidrosis classification, again, is subjective. We need to pass a gauge on the armpit, smell, and say that it is a low or strong smell. Is subjective. This is really important to know that even while the tangles of the sweat glands or the acrial glands are between 2.5 to 3.5 millimeters of depth, the apocrine glands are deeper, are between 3 to 4 to 4.0. That's why we need at least a needle to 4 to 5 millimeters to reach both type of glands or tangles of glands. And the function is different. While the acrial glands are the thermal regulation because they produce 90% of all the sweat, the function of the apocrine glands is the lubrication of the hair and the skin at the same time. I mentioned treatment surgical and non-surgical. There's a lot of procedure surgical. I don't want to mention that according to the time. And about non-surgical, we only put focus to intradermal radiofrequency. Well, our objective is the destruction of the acrinal apocrinal sweat glands without damaging the papilla dermis and epidermis. We use bipolar radiofrequency. There's no selectivity. We try to destroy, to put thermal coagulation inside the dermis in different layers. We can choose the depth, we can choose the time, we can choose the intensity. Our trademark goal is that, create thermal coagulation in different layers of the dermis. You use this device, intensive device, 25 microneedle, non-insulated, gold-plated, super sharp, taper needles, and we can choose increase the depth between 0.0 millimeters. That's why we can make our own recipe if we want. And important to say that it's disposable tip, only 1,000 pulse, and it's smooth more insertion. They mean that we can reach the needle at the layer that we want to reach, okay? For sure, because it's a slow movement, okay? And here are different kind of needles, and we like this one because it's a fractional pulse osmosis in the way we can obtain uniform heat dissipation and at the same time wider coagulation of all the dermis around the needle. That's why we can reach more tangles or sweat glands. And this is important to mention too. We have the impedance, is the reaction of our body to the radiofrequency. While the high by the surface and the hypodermis has a high resistance to the radiofrequency, the dermis has a low resistance. That's why our radiofrequency flowing directly to the dermis and reach every tangle or sweat gland. For example, here, we introduce the needle, and you see the heat going to surround all the tissue in the dermis. This is my article. I started with this type of treatment from July 2014. My first 37 patients gave me the possibility to write this article in HPS, in which one I found 50% of sweat reaction, 80% of the patient, but with 4% of complication. And that's why I continue study and looking for a device to decrease my average of complication. This is a classical minor test in our patients. I can show you the way we perform the other armpit, please, the other armpits. You can see here the drawing, okay? And this is the area. It was just injection with lidocaine, and I performed the treatment. Yeah, here is step by step the application that you can see here in a minute. Well, in post-treatment, only ask for Listerine, Vaseline, no more than that. I avoid sun exposure, of course, during the bruise to avoid PIH, avoiding vigorous exercise. And if in other problem, I add chlorhexidine because we can reduce the anaerobic flora that cause a lot of strong smell. Contraindication, of course, any kind of regular frequency, pacemaker, pregnancy, local infection, and Kellogg's backgrounds. This is a really important article. I tell you that please try to read it because they found, after great research of some articles, a strong indication for hyperhidrosis treatment by microneedle radiofrequency. Complications and side effects, edema, swelling, pain, and paresthesia only takes hours or few days, but the real complication is scar, transitory or permanent, and PIH. Since I use this device, fortunately, I haven't had any. These are my actual parameters. 3 paces in each session, ideal 3 sessions, once every 30 days. The DIT that I choose between 3 to 5. In this case, I choose 5 because I want to reach not only eccrina and apocrina glands too, because the patient had other problem too. Energy level between 20 to 25, I try to choose between that, and the pulse duration between 140 to 200 milliseconds. Well, I start the treatment. If you agree, please do that. Okay, I draw in the area that was just my colleague applied the lidocaine with epinephrine, as you can see here. Okay, can you give me any kind of antiseptic? Yeah, don't worry. Doing that, and the foot. Okay. Perfectly. Okay, I'm going to show you, if you give me a close view. Here it is, the 5 millimeters, the 25 millimeters of plated gold needles, okay? I need to do that with a little and a strong movement to be sure I can reach the dip that I choose. With another device, which act like a punch, doing that, ta, ta, ta. For sure, I don't know if I can reach the dip that I choose, because act as a wall. For example, 49 microneedles at the same time with this strong and fast movement. In some cases, reach the dip that I select, in some cases not. That's what maybe I don't know, and I made a stacking procedure. In this way, I can reach the risk of burns or scars. But with this gentle way to send the energy, for sure, I can reach the dip that I choose. In this case, 5 millimeters of depth. And again, why I choose that? Because the tangle of the eccrina glands are shallow, between 2.5, 3.5, and the eccrina tangles are deeper, 4 to 5 millimeters. That's why if I have this kind of length of needle, I can be successful in both of disease, osmidrosis and hyperhidrosis too. Do you feel any pain? I give you the advice to do it with lidocaine by injection. The patient don't feel nothing at all, as you can see here. I use a lot of energy. If you can do a close-up to the device, please. 20 watts is a lot of energy, and I send it in. Well, let me change. Can you change me if I want, I can change it now to the major 200 milliseconds and try to be more aggressive and more power. 20, 25, please, 25. Okay, start. You can see here the best treatment that I can do it with the majority of our power and the majority of our millisecond of durations. And I can send that without damage the skin. I only leave a little bruise after that. Please, a close view here to show the bruise. And I need to do that 3 passes with each parameter. In some cases, I do stacking, especially in male, because the skin is more thicker and I can set more energy in the same place, but it's a little risk. It's not a good advice to do that. Let's do it in the first time, trying to do it when you have more expertise. Okay, we have 3 minutes. In 3 minutes, I can finish this this side, and the other side we completely after we finish the presentation. Well, I give you this conclusion. Please, again, if I can put the presentation. Well, this is another topic of this platform, not only for face, not only for other parts of the body. We can do in that too. Please, if you don't want to do it that, trying to looking for another treatment for hyperhidrosis, because it's 3 to 5% of all population around the world suffer about that. And in some cases, the only solution is temporary botulinum toxin. And this is a way that I can for sure destroy eccrina and apocrina gland. An average, not all, of course, 20 to 30% in every 3 passes, every 3 treatment. That's why it's maybe good enough to change the hyperhidrosis disease severity scale from 4 to 3 to 3 to 2. And this way we can give the possibility to the patient to insert to the social and labor requirements. Only with this treatment, and please be attendant to your patient. With the patient to suffer about hyperhidrosis have several social problems. I completed the treatment to complete my 2 minutes of work of this workshop. 1 minute, okay. Remember that the reach that I can get in any treatment, the quantity of eccrina gland and apocrina gland that I can destroy, it will be forever. Maybe after a month, after a year, the patient can again have a little relapse of the treatment by another sweat glands, which one start to produce more sweat than before. But I can do it again after a year without any problem. If you have only as a tool the botulinum toxin, you have a patient every 6 months with the same problem. And botulinum toxin can give you a solution for hyperhidrosis, but not for osmidrosis. Believe in that. And this is the way we leave the bruise on the skin. No more than that. We only put Vaseline on the over the armpit of the patient and request to avoid strong exercise.